I wanted to be the doctor in the hospital that somebody said, you know, orthopedics is operated, and vascular surgery is operated, and neurosurgery is operated, and we have a big problem. We have a big wound, or we have an arm that doesn't function or work, and we're at the end of our comfort level with doing these things. Can you help us bridge the gap to have that patient have the maximum recovery that they could possibly have? And for someone to ask you that, that's a big deal. And to be able to come then into that family's life and know all those surgeons and have them rely and trust in you to do the best for that child or their mother or their grandmother, that's very rewarding and very fulfilling. And that's really why I did it, is to be there to close that gap, to get a patient to the end of what they need, be it a cosmetic surgery so that they feel better about themselves, or they change something that they couldn't change by diet or exercise, or a young girl who has an injury and nearly loses her arm, and to stay up all night long and work very hard to try and get that young girl the best outcome that she could possibly have. It's important to me. As a new upcoming plastic surgeon, it's important to lean on people who have experience, and the fact that they were so open to say, call me if you need me, I'm happy to come in and help you, how can we help you be successful, was important. And as an extension of that, the entire office staff wants me to be successful in my career, in my family life, and in all the ways that I treat patients. And every one of them, from the interview process to the starting working here, has put everything that they have into making sure I'm successful, be it calling to find a form to make sure I'm credentialed somewhere, or making sure that I got the right place to park, or finding a number for a patient that I just couldn't find. Or one of my first patients here was so difficult, and they found a number for a surgeon in Louisiana to transfer a guy. I mean, everyone wants the patient to get the best care and wants each other to be successful, and you don't find that everywhere. And that was probably the most special thing about Northland Plastic Surgery, is the second you walk in the door, I mean, you got a grandma, you got a mom, you got a dad, and you have siblings, and they're not even related to you. You present a patient with the options that they have, and most importantly, you listen. You have to listen very carefully to what that patient is telling you, because what they're telling you isn't always really what they want. And that's not to say that I'm ever going to tell a patient what they want. That's not what it is. But as a surgeon, you train for a very long time to learn what an outcome of an operation is. And if a patient comes in and they tell you what they want, it's then your opportunity to guide them to pick the right operation to get to where they want to be. And being able to talk patients through those cosmetic operations is very rewarding, and to help them pick something that they're going to get the outcome that they want, so that they, at the end of the day, when they look in the mirror, they say, this was a good choice for me, and I'm happy with the results that I have.